Billions of dollars could be saved from healthcare budgets around the world if most people cycled 3 kilometres a day and doubled the amount of walking they normally do. This is the conclusion of a study published in the medical journal The Lancet, which explains how the impact on 7 diseases could be reduced if countries promoted active transport as an alternative to going everywhere by car. Take Britain, for example.
Over a 20-year period, we estimated about £17 billion costs would be averted to the NHS, whether that was taken as savings or whether it was reinvested in the NHS to provide additional care would be, of course, a political decision. So the costs would build up, the costs averted would build up over time, and in fact, if you look beyond 20 years, they would probably be even greater because some of these conditions take quite a long time for the preventive effect to be experienced.
Britain has made a start in promoting active transport, but the scientists think a lot more needs to be done.
Well, we know from cities like Copenhagen, where they have an average cycling distance of about 3 kilometres a day, that it is possible to get a lot more people cycling. But obviously that does take political will, and you have to make it safer for cyclists because there's a perceived danger and to some extent a real danger, but also perceived danger for cyclists on the road. And so we need to make cycling safer, to have protected cycleways and so on.
The Lancet report on active transport provides evidence, but action is now needed.
I think the call to action is to prioritise active travel much more in terms of urban transport policy. So I'd like to see more safer cycle routes, real active campaign to get people who are quite sedentary on their bikes and walking, of course. And we know that people who use public transport are more likely to walk to the station or walk to the bus stop. So it's really got to be a focus of public policy to get people onto their bikes, not using their cars so much in urban areas.